Well, thank you, Michelle. I'd firstly like to say how heartening it is to see all of you here today, and to know that we can perhaps book a bigger venue next time, because without a grassroots movement, we cannot change anything. And I must also reiterate what Michael said. Listening to him, for anybody who's studied this issue, it is very clear that the government has turned the arguments upside down. The arguments that apply to us and the truth that we are revealing, they are using to suggest that the vaccines are good for humans, and that it's the unvaccinated children that are a risk to public health. And you know, it's clearly 2 + 2 does not equal 5. Once you know the ingredients of the vaccines, it is very clear that they're not health-promoting substances. So my talk today is to try and help you understand how we've arrived at this position. So just to emphasise what Michael said, here we are in a democratic country that professes to promote global human rights, yet we have lost our right to the informed consent of a medical intervention. That's your right to bodily integrity, what you inject into your bodies. This is being injected into our healthy bodies, our choice for healthy people, without being told what's in these vaccines. And so now in schools, we are removing the healthy children from the schools, not the sick children. So I'd just like to say, in Western Australia, we recently, they pushed through with 6 days of discussion in the Parliament. The no jab, no play policy was bulldozed through the Parliament. And this position of choice in a medication was not represented by a single politician. Our voice was not represented in this Parliament. And it was bulldozed through in the 6 days. So we did. Within a week, we held a rally, and on that short notice, we managed to get 100 people to the CBD and more, knowing that a lot of them risk their jobs now if they come. And we demonstrated for our rights, our freedom of choice in medication, and the acknowledgement of the vaccine injured in these policies. So, and on the news that night, they only broadcast a small section of the rally. They did not mention freedom of choice or vaccine-injured children. And after the small section that was shown, they had Mr. McGowan, Mark McGowan, our Premier of Western Australia, telling parents to bugger off. That is what you call democracy in Australia today. Our voice has been removed. And this is too important an issue just to leave and to capitulate to having these things injected into your bodies. Stand tall and pass the word on, by word of mouth. We can get this to the people. They will see the reactions in their own children. And unfortunately, more people will be sacrificed, but we must maintain our right to choice over our bodies. I'd like to just ask you and point out to you the politics of this. Now, you know that the media presents only one side, which is the anti-vaccination issue. How many of you, when they promote the no jab, no pay and play in the media, how many of you have heard them say how many vaccines children now require to participate in society in those media articles? Never. Not a single article. For the people that do not have children, today's children are required to have 16 vaccines are recommended on the National Immunisation Program, and most of those now are mandated for children to have an early childhood education in Australia. That is what no jab, no pay and no jab, no play means. And this has been abbreviated by the Murdoch media and pushed through the media to manipulate public behaviour. I'd also like to ask you, how many people have heard of the debate and discussion of your removal of your religious, philosophical and conscientious right to object to a vaccine in your body? Are you aware that that right was removed in 2015 when this bill was passed? Did you see any discussion in the media?
No.
Were you informed? No. So the public's interest in these government policies has been removed by the lack of information provided by our non-independent media. It's a corporate-sponsored media. Further, the policies, I'm going to just speak a little bit about the politics of these policies, because in 2015, when Scott Morrison was the Minister of Social Services, he approved the mandating of 16 vaccines in social services policies for welfare benefits, currently called the No Jab, No Pay. But at that time, in 2015, there was no legislation or regulation in any health act in Australia to make any vaccine compulsory. Yet Scott Morrison mandated 16 in a social services policy. It is not a legitimate policy if there is no legislation to support that public health policy. Yet it was approved. And the media did not inform you at the time that the 16 vaccines were needed now for parents to get thousands of dollars in welfare benefits. And for the people that need that money, that rely on that money, that's a significant coercive factor. Thousands of dollars. Up to $26,000 now is the maximum that some people can get from the government. So there's been no media debate, public debate, by the community of scientists and academics of the undermining science in this policy. There's been no justification. And what we need to know is who's doing the risk assessment for this policy? Where is the transparent evidence of the risks and benefits of 16 vaccines in developing children? That has not been presented to the public. Transparent evidence of risks and benefits. So let's look at who is doing the risk assessment. So it's very important that the media defines the word unvaccinated in 2019. So next time you're talking to people and they're not understanding your views of why you don't want to have some of these vaccines, point out to them that unvaccinated in 2019 means that you haven't had 16 vaccines. It doesn't mean you haven't had any vaccines. It means that even someone who's had 10 may still be called unvaccinated and prevented an early childhood education in Australia today. Having studied this topic for now probably 15 or more years, what we needed to look at was what did control infectious diseases in all developed countries. And this issue was never a medical issue. This is what you call a public health issue, an environmental health issue. And there are many health issues that don't require a medical solution. And infectious disease control was one of them. The causes of these diseases are environmental and life circumstances and genetics as well. It's a combination of factors. So it's not just the fact that the bacteria and virus exist. And these were controlled by changes to the environment by 1950 and 60 in all developed countries, and without the use of vaccines. So this expansion of the vaccination program has happened since these infectious diseases were controlled in all developed countries. And this is the key. It's not a medical issue, but the field of public health was merged under the medical umbrella in the 1990s. And this gave the medical community control of the information that they provide, that is provided to the public on vaccines and infectious diseases. Now, at the same time, they removed the allied health professionals from being able to provide information on vaccines and infectious diseases. It's become simply a medical issue, right? When in fact it was always a public health issue. It's an environmentally related health issue, and it's controlled without vaccines. So just a little bit about how they're controlling the information that you're getting. So once you've removed the allied health professionals, your chiropractors and your naturopaths and all those other people that are all qualified to assess the science, It leaves you with medical doctors, and these medical doctors are now being regulated by their professional board. So in fact, their autonomy to provide information on the full body of literature that they see has been removed. In their regulations, the Medical Board of Australia requires them to promote government vaccination policies, right? And they are educated with pharmaceutically funded industry studies, and therefore, if they see other independent research that opposes what they've learnt, they're required to present it as their personal opinion and not with the endorsement of the Medical Board of Australia. And in that way, it reduces the credibility of the doctors' information that they're providing to you, as valid as it is from the peer-reviewed journals. But on top of that, if they do present their personal opinion and it's what they consider anti-vaccination material, then they can be deregulated for presenting that personal opinion. So this is what you call removing the autonomy from doctors to provide the best, the information in the best interests of their patients. And yes, so doctors are now can now be deregistered for anything that the medical board considers anti-vaccination material. So this situation has resulted in indoctrination in the population. Indoctrination of doctors with selected studies. All the information that they are provided with on vaccines is the pharmaceutically funded research and industry studies. And that's what's used also in the government policy. So there's no scrutiny of the science by the entire body of health professionals that are qualified to do this, or academics. We've all been removed from that. And it's just the doctors now that can select the accepted science on this issue. So the risk assessment for these policies is being performed by the pharmaceutical companies. And this is being assisted by, on the government advisory boards, they have members, many of them now have links, conflict of interest, financial conflicts of interest with the pharmaceutical companies on those government vaccine advisory boards. So the indoctrination and the selection of the accepted science on this issue is now combining with government vaccine advisory boards that have serious conflicts of interest. Now you need to add to that also, we have a government regulator called the Therapeutic Goods Administrator. And that regulator has two roles. It is to approve vaccines and drugs for the market, but it is also to monitor the safety of those drugs and vaccines in the population. So that's a conflicting role. Now what if that body, that government body, was 100% funded by the industry? That's a fact. It's called a cost recovery system. That's how they justify it. And so the government regulator is funded by the industry that markets its own vaccines and drugs and then monitors their safety in the population. Now, what sort of an incentive does a body have to look at safety of that drug when they profit from the drug if they don't monitor it properly? And that's part of the problem, that the government has never set up what they call an active surveillance system. And an active surveillance system means that every person that gets a vaccine must be monitored, not for just the 2 weeks after they've had it, which is what is the literature in the vaccine trials by the pharmaceutical companies, but they must be monitored for at least a year and preferably several years to see what long-term effects, autoimmune diseases, cancers, all those things, diabetes, what long-term effects are these vaccines having? If you're using a passive system which relies on the public ringing up to